Hi, my name is Dusty Feaster, and I am a physical therapist and lymphedema specialist. I've been practicing as a physical therapist and a lymphedema specialist for the last 20 years. Lymphedema is really dear to my heart, and I hope that you can learn a little bit more about what lymphedema is. If you want to know where to find a lymphedema specialist, I'm actually at the Women's Hospital at High Pointe Therapy, and we have a terrific crew here. Lymphedema is an accumulation of fluid. It's mostly water and proteins mixed in, and it accumulates just under the surface of the skin. Lymphedema can occur anywhere. It's always going to occur where lymph nodes were removed or there was radiation or damage to the lymphatic system. So for instance, for a breast cancer survivor, if lymph nodes were removed underneath the underarm area, then they could have swelling in their arm or in the trunk on that side, both on the front and on the back. If it's an individual who is diagnosed with head and neck cancer, they maybe had radiation at the neck, and so that could affect swelling for the face and the neck area. Lymphedema can be caused either by usually two different modes. The first is called primary lymphedema, and primary lymphedema is something that someone is born with. So maybe they're genetically, something does not form in the correct way, either the lymphatic vessels or the lymph nodes in that area. And so over the course of time, they may not present with any swelling at birth, but then as they age and go through puberty or pregnancy, and that lymphatic system is tasked, then that can create swelling. Secondary lymphedema is the second way that lymphedema can occur, and that is due to a secondary cause. So something like lymph node removal, radiation, chemotherapy, recurrent infections, so someone who has like recurrent cellulitis episodes, or some trauma like in a car accident that caused damage to the lymphatic system. The main difference between lymphedema and edema is that lymphedema is a disease process in and of itself. So when someone has lymphedema, oftentimes they'll say, does that mean that my cancer is back? Because I have swelling, is there something else going wrong in my body? And that's not usually the case. Lymphedema is just it's a disease process in and of itself because of something that has happened prior to that. Edema is not a disease in and of itself. It's a sign of something else in the body that's happening. So very simple, like someone who is pregnant might have edema in their legs because there's a higher burden on that lymphatic and circulatory system. Or it could be something, could be a sign of like a heart or a kidney or liver issue. Yes, lymphedema can be difficult and challenging just in feeling accepted because you might look different than someone else, and it's a body image thing too. Our body changes and we have to accept how it has changed and how it looks differently. In addition, if you have lymphedema, you have to be more cautious about the things that you do that would cause that swelling to worsen. So you have to wear things like compression garments. So I have some examples of different kinds of compression garments, and this is going to make you feel a little different too. You have to think about when you exercise or when you fly on an airplane that you will want compression. So this is an example of what we call a gauntlet. Everybody always asks, what in the world is a gauntlet? And it's just a glove without fingers. So that's a gauntlet. Compression sleeves, so these can be put on and they would compress the entire arm. This is an example of a custom garment that you may have to wear. This is for a leg, and it's in a really pretty pink, isn't it? So pretty. And then another example of sometimes some things that we use for compression. This is more of a Velcro strapping type piece. So this is pretty cool because someone who can't pull on a garment can Velcro a garment together to get the compression that they need. With daily activities, it's just highly encouraged that if you have lymphedema, that number one, you see a lymphedema specialist so that you can get the training that you need, because it is a lifelong management. But compression is something that you will want for your daily activities. So lymphedema is treated by about 4 to 5 different components. The first component is manual lymph drainage, and that's a hands-on, kind of like a massage. We don't like to call it massage because if somebody expects massage, they think you're going to massage their muscles. And the lymphatic system is literally right underneath the surface of the skin. So if you take your fingernail and try to slide it under the surface of your skin, that's how close it is to the surface. And so when we do manual lymph drainage, it's a very gentle massage-like technique that is directing that fluid up in the direction that we want that fluid to go. That's the first component. The second component is bandaging. So either with short stretch bandages or something along the lines of that Velcro kind of mechanism. If you can't bandage yourself, this is always an option as well. And then the third component is teaching you exercise. And exercise is not something that is exercise for strength, but exercise to promote circulation. So we're trying to promote with diaphragmatic breathing, with just doing some fist pumps or some elbow bends or marching. Any of the lower extremity exercises, if you had swelling in your legs, would be done laying down, because we want to help that fluid to go back to the heart. So exercise is the third component. Fourth component is just taking care of your skin so that you prevent infection. And then sometimes we recommend a compression pump for home. Depends on where the lymph nodes were taken. So we'll make it very simple. So if you had lymph nodes removed from under your arm, then that same side arm and trunk will be affected, from the ribs to the collarbone on that side, as well as on the back of the body. If you had lymph nodes taken from your hip area, from the groin or pelvis, then anything from your belly button down can have swelling, so legs, genitalia included, and even that lower abdomen. If you have lymph nodes removed or radiated, and I should say radiated too, because they don't necessarily have to be removed, but removed or damaged at the neck, then you're going to may have issues with facial and neck swelling, anything above the collarbone. Typically, lymphedema presents as asymmetrical swelling. So that's another, going back to the question we asked earlier, how do I know if it's edema or lymphedema? Edema is something that is going to be bilateral, meaning both sides are swollen and very symmetrical. That's usually not lymphedema, it's usually edema. Lymphedema is going to be something that is one-sided, and it is related to the side where you know that there is known damage to that lymphatic system. Does not have to be in the limb. So a lot of people think that if it's not in my legs or my arms, then I don't have it. A lot of the presentation that we see early on is more in the trunk. So it could be breast related, genitalia related, or abdomen that you notice swelling first. So it's very important that if you feel that you have the signs or symptoms of lymphedema, ask for treatment sooner rather than later. It's so much simpler to manage lymphedema in the early stages than if you wait until it gets worse. And lymphedema is a disease, so it will not just go away on its own. So treat early and don't wait.